Hey everyone, thanks for joining me today. I am Kelly. I am the owner of Champ Therapy and Wellness. Today I'm going to present with you guys on fitness for cancer fatigue. So just a little background information. I am, again, the owner of Champ Therapy and Wellness. I am a physical therapist, occupational therapist, and personal trainer. I am a mobile outpatient service, so I come to your house, your office, or wherever you want to meet, whether it's in a park if you want to work on hiking, whatever that may be, or whatever that may look at. I come to you for therapy, or I do offer virtual services, and I do the same thing personal training wise as well. So why am I presenting to you on cancer-related fatigue? My mom was diagnosed with ovarian cancer. It's probably about 15 years ago now. All started because she's kind of a smaller lady and was looking like she was pregnant. Went to the doctor, found a football-sized tumor and another small tumor when they went in to remove it, and I believe it was the smaller one that was actually cancerous, not the football-sized one. Anyways, that obviously led to some treatment, so she had to have surgery, get everything removed, and then went through chemotherapy for about 10 years following that first diagnosis. Cancer came and went, kept getting it back, and I think total it was about 5 or so, give or take, rounds of chemotherapy, 4 surgeries. One included taking out a good portion of her large intestine. And then this final time, about 5 years ago, she had radiation for the first time, and knock on wood, that seemed to have kicked it. Within the past few months, she has been considered in remission and doing great. But due to all that, it kind of led me to be interested more in the cancer field and how I could help with the career I was going into. I was a sophomore in college when she was first diagnosed. So that led me to doing a outpatient clinical during my graduate school at a cancer clinic. Learned a lot more about how I could help people. Again, close to home was my mom, but we've had other family members, friends diagnosed as well. And it's just a population that I felt was underserved and needed more information. So that is why I'm here. So cancer-related fatigue, it is persistent subjective sense of tiredness related to cancer or cancer treatment that interferes with usual functioning. The main difference is that cancer-related fatigue tends to significantly impact your daily life. So a lot of people have normal fatigue. A lot of people say they're tired. A lot of people don't get a lot of sleep. But the difference between normal fatigue and cancer-related fatigue is that cancer patients tend to remain tired even after they rest, and it significantly is more disruptive to their activities of daily living. So it's more negative. Disruptive to just going and shower, just doing the laundry, that type of stuff, where it's significantly hard for patients with cancer to do that. So those going through cancer treatment used to be told to rest more often and to avoid physical activity. Now, thank goodness, research has come out and we now know that exercise actually helps to reduce cancer-related fatigue. So 70 to 100% of patients receiving forms of cancer treatment suffer from cancer-related fatigue. So it's a good topic to educate on. So here is a research study to show you the main point of how exercise can help. There's many similar studies. This one was kind of a direct to the point one, so this is the example I'm using. This was actually with breast cancer patients, and it was a 6-week trial with a walking program. So they had an experimental group and a control group. The control group received their radiation treatment, and they were encouraged to stay active, but weren't really given detailed instruction, where the experimental group was getting radiation for treatment and being encouraged to stay active, and they were actually given a low to moderate intensity exercise program. Mainly walking is what they were giving. But at the end of the 6 weeks, they used different measures to see how the patients were doing or how the groups were doing. and the experimental group scored higher than the control group, which what this meant is with the forms and measures they used, those that received an actual prescribed exercise program had less anxiety, less fatigue, less difficulty sleeping, and actually improved physical functioning by using the 12-minute walk test. That is just a test that can be used to look at your endurance and physical functioning by therapists. So recommendations is you want to begin exercising in the beginning, whether you've been exercising or not. As soon as you get that diagnosis, you want to make sure that you're on a good, solid exercise routine. Exercise throughout treatment, even if you don't feel up to it, and beyond. So you want the exercises to be low to moderate intensity. It's going to be a rate of 11 to 13 on the Borg scale, which I'll go into in a minute. You want to build up your consistency and frequency. So maybe start with 2-3 days a week, progress up to 5. Start with 10 to 15 minutes, progress up to 30 minutes, or beyond, depending on your lifestyle and time that you have. Majority of your exercises should be cardiovascular based, aerobic based, so biking, walking, jogging, swimming, the type of activities that are more cardio considered and use the larger muscle groups. And log your progress. Make sure you take accountability for what you're doing and cheer yourself on along the way. So this is the Borg scale. It's 6 to 20, but basically what we're looking at here is just that we want to work out around that 11 to 13 range. So that's fairly light to somewhat hard, as you can see in that chart. So the benefits of exercise is you get improved endurance, improved flexibility, improved mobility, less fatigue, quicker recovery time from treatment or surgery. I'll go into that a little bit more. And overall, most importantly, an improved quality of life. So with the quicker recovery to surgery and treatment, obviously sometimes after surgery you'll be put on lifting restrictions. I believe my mom was put on a lifting restriction, so she wasn't able to work out right away. But you can kind of work out within that. If you're not allowed to do any strength exercises, you can at least try and get up and walk as much as you can. If you go into surgery stronger, then you'll come out and have a quicker recovery, easier recovery. A bunch of different things play into that factor. So main thing is you want to build consistently, start reasonable. Like I said, 2-3 days a week at first for 10 to 15 minutes. Once you're consistent doing that for a week, start increasing that time or adding an extra day. Once you're consistent with that new time or frequency for a week, then continue, add more time, add another day, and continue on. To hold yourself accountable, try getting a walking buddy, or a little bit different, but my friends and I, we have a workout group, and just to hold ourselves accountable, we send some form of picture, whether it's the results on our fitness watch, whether it's a picture of the treadmill, whether it's a picture of where we're walking, picture of weights, whatever we're doing, we send a picture to kind of show proof that we are being active. Someone usually sends it at least once a day, which kind of reminds the rest of us that, hey, make sure we're moving, make sure we're getting those steps in. So accountability is huge. You can make an exercise log or diary as well. And if you're having a really difficult time, hire a personal trainer. This way you can ensure you're doing the exercises safely. You're more accountable because you have appointments and you put some money into it. So an example of how you can get started, this is kind of middle of the road with 4 workouts a week. So Sunday, rest day, relax. Monday, a 30-minute walk at that low to moderate intensity. Tuesday, a strength workout for your arms and legs. Again, low to moderate intensity. Wednesday, you go for another walk. Thursday, you rest. And Friday, you do a 15-minute walk and then throw in a little bit shorter or just as long of an arm and leg workout. And then Saturday you are resting. So like I said, middle of the road, ideally you would add in another day. You can switch up your days. It can vary week to week depending on your schedule. Just make sure you are getting it in. So here's an arm and leg workout example. I always say use timed workouts. If you use timed workouts instead of repetitions, you're getting more of a cardiovascular workout, and that's what we're aiming for to help with that cancer-related fatigue. So working for about 30 seconds and then resting for 15 seconds, and then doing that with each exercise 3 to 4 times. So you can rotate through the exercises 3 to 4 times, or just do one exercise 3 to 4 times and move on to the next one. So an example would be doing that sequence with bicep curls, squats, planks, lunges, and push-ups. Full body workout. You're getting the cardiovascular in due to the timing of the workout, and pretty quick workout. That one there would probably be roughly a half hour if you were to do it. Sometimes with the surgeries or treatments, you need a little extra guidance, a little extra range of motion depending. Radiation can often tighten the surrounding muscles, and surgery can result in a weakness of muscles and reduced range of motion. So that's where physical and occupational therapy might be beneficial, because you can gain range of motion, reduce pain, build stability. With weakness, even like personal training might be okay as long as you are healed from surgery and you don't have restrictions. If you have restrictions and we need to address certain joints or muscles, physical therapy or occupational therapy would be most ideal and more skilled. If it's just kind of the exercises we're aiming at fine-tuning, then that can be done in person or virtually. The radiation with the tight muscles, I definitely recommend going in person, at least in the beginning for that, because hands-on therapy can significantly help you. So here's my contact information. If you guys have any further questions or want to talk about anything specifically, feel free to reach out to me anytime and I will get back to you. But really the main thing, cancer-related fatigue. So you're going to be tired. You're not going to feel like working out. You're not going to feel like going for that walk. But I promise you, research has shown that if you do push yourself, if you do go out for that walk, you get that exercise in, you will end up being less tired in the long run than if you did not do it. It's hard to believe sometimes because either way you're tired, but it would be significantly more if you do not incorporate exercise into your treatment. Recommended once you kind of build up is at least 150 minutes per week. So that's about 30 minutes 5 days of the week. So if you have any questions or concerns, please reach out to me. I am always happy to talk and help, and I wish you guys the best along your journey. Thank you so much.